BammerTV.
Welcome back, BammerTV, to another great day here at NECANN Boston 2019. I am here with Kathleen from Canna Care Docs. How are you today, Kathleen?
Good, Dave. How are you?
Very well, thank you. And so what is it that Canna Care Docs does? What is your primary function in the cannabis industry?
Well, our mission is to bring cannabis into mainstream medicine. And we do that by treating patients. We see about 80,000 patients a year. And we are, just collecting data as to, the efficacies, what some of the positive effects are, some of the negative effects, what kind of medications they're able to come off of, the benefits that they've experienced, how it's been able to, help them go from having a debilitating illness where they can't even leave the house to being able to get out, do their grocery shopping, spend time with their children, grandchildren, and just live a better quality of life.
All right, awesome. So you said you help about 80,000 patients a year. Now, is that just in the United States or is that across multiple countries?
That's here in the United States. We also do certify patients in Canada as well. So we have a parent company out of Canada called CB2 Insights, and under CB2 Insights umbrella we have Sale Cannabis, which is a cannabis medical record software. It's a proprietary software that enables us to track patients over the course of their treatment with us. And when I say track, I just mean, when they meet with the doctor and come in, we check to see how they're doing, again, whether or not they've been able to come off any medications, how cannabis is working for them, what types they're using, what methods of ingestion, how often they're using it, what strains, things like that.
So you're basically just collecting the client data for what they're actually using the cannabis for.
We're collecting what they're using the cannabis for. We're collecting what their main condition is. We're collecting whether or not they've used cannabis in the past. For example, we just looked at 6 weeks worth of data across a few states that we're in, and it shows that Rhode Island and Maine have a lower percentage of naive users, which means a higher percentage of experienced users. And then in states like Illinois and Maryland, the percentage of naive users is higher. So it's about 67% or so in Illinois of naive users. And we're seeing that because we're seeing a lot more seniors enter into the program as well.
And that's because of things like glaucoma, arthritis, things like that?
Absolutely. Arthritis is a big one. Seniors are on many medications. The average senior takes about 5 to 12 different medications a day. And what happens is, as those medications mix with one another, there's more and more side effects. So now they have to take more medications to combat those side effects. So we're seeing a lot of polypharmacy in the senior population, and using cannabis as a way to help them get off some of those medications that they've been taking, and just, again, increase that quality of life.
So I know that cannabis is really good for things like anxiety, insomnia, pain management, but really, I always wondered about this. Does it have any effect on blood pressure, and can it help maintain a healthy blood pressure?
Cannabis, if you have high blood pressure, you always want to consult with your treating physician with your high blood pressure. If you are taking medications, you don't want to just stop or discontinue the medication. You want to work with your cannabis physician and with your primary physician to get a good balance. It absolutely can help with lowering blood pressure because it does try to bring homeostasis to the body. So So it does help you sleep better. It helps you to forget some of those stressful situations. And so by doing that, it does tend to bring that blood pressure down just a bit.
Okay, but it doesn't have, like, cannabis or cannabinoids themselves wouldn't have a direct effect on, like, blood pressure or anything like that?
No,
Okay.
no, and it all depends on the type of strains you're using. Some strains with a higher sativa percentage, or some full sativa strains with a higher THC percentage, I should say, can cause anxiety, rapid heart rate, things like that. So you really want to be cognizant of what you're using.
Gotcha, okay. And what other kinds of medications do you see your patients really coming off of? I'm assuming opiates is a big one.
Opiates is a big one. Mood disorder medications is another big one. We've seen patients be able to come off their anxiety medications, their depression medications. We've seen them be able to cut back on seizure medications or come off of it altogether.
Oh, wow.
Yeah, so it's been really beneficial, and the amount of information and positive effects that we've seen over the past 6 years that we've been treating patients, really is going to propel this. What we bring to the table in terms of patient information and, just research and statistics as to what's working, that's going to, I think, forward it into the mainstream and really push for that mainstream education, medical society,
Awesome.
community-wise.
So, very obviously, you're a big supporter for medical cannabis, but what's your stance on recreational cannabis as it's slowly getting introduced throughout the states?
Well, I think there's a place for recreational cannabis. Absolutely. There are people that want to just use it here and there, and, maybe on the weekends, or, if they go out with friends, socially, things like that. What we're finding is these recreational users are going in and trying it for the first time and finding out that, wow, this really works. It helps me get a great night's sleep. I don't have a headache. My back's not killing me. And now they're looking at, well, what else is available? How can I use it to help me throughout the day? And then now they're looking at creams and topicals and tinctures and other methods of ingestion.
Yeah, definitely. So, I myself use CBD oil on my shoulder all the time. I had one last question. This always happens. I'm sorry.
That's okay.
So, where did you guys start in? How did Canna Care Docs start? I'm assuming when things became medically available, when we started getting medical cards, that's kind of where you guys started, I'm assuming, or is it go back further than that?
No, so we started in April of 2013.
Okay.
We opened our first office in South Boston.
South Boston. Okay.
So at that time, there were no dispensaries in Massachusetts. There was no online registration system. The only thing you needed was a signature from a doctor or a nurse practitioner. So we opened in Southie. About 8 weeks later, we opened the Worcester office, and that's when I joined the team. So I've been here since the beginning.
Very nice.
And yes, it's been quite a journey.
I can only imagine.
And then from there, we just kept investing in ourselves and opening more offices. And, we just had about 5 or 6 in Massachusetts. Then we opened a couple in Maine. Then we opened more in Massachusetts. So we're up to 10 in Massachusetts. We've got 4 in Maine, 3 in Connecticut. We've got 2 in Delaware. We're in Pennsylvania. We've got 2 in Maryland, 4 in Colorado, 1 in Arizona.
So you guys are
2
all
in Illinois.
That's awesome.
Yes.
That's
So,
awesome.
And you know what? What propels us is education.
Yeah.
It's really education. And just by those studies, or just by the statistics that are showing the naive users, it just goes to show that there's still a lot of education needed out there.
Correct. And that's why we do what we do, actually, to make sure that people who are just getting into the cannabis industry can have the information that's going to help.
Yeah.
And a lot of times they don't want to go to a doctor or anything like that. They're just going to go on Google. What is THC? What is CBD? How does CBD affect me? And that's why we want to do interviews like this to really help further the education.
Yeah.
So, Kathleen, thank you so much for your time.
Oh, you're welcome.
Guys, remember to check out Canna Care Docs all across the United States and in parts of Canada as well. And remember, guys, for everything weed and weed related, keep it here on BammerTV.